We're talking to Dr. Smith and Hayes, and they're giving us some information in reference to their background, education, and some of the things that have been important in terms of bringing them to where they are today. And of course, what we'd like to do, Dr. Smith, is to continue our discussion by having the two of you give us some information about some of the training that is involved in terms of what you do. How do you train to be a pediatrician, Dr. Hayes?
Okay. So
Dr. Smith, and later you, Dr. Hayes.
Yes. So I did 4 years of college, and you don't have to necessarily be a biology major, but it can be helpful. But any major is fine as long as you have the requirements for med school. And then in college, you take what we call the MCAT. So back in my day, the MCAT was on paper, but now it's on computer, and offered, I think, once a month. So once you apply to med school, you take the MCAT, make sure your grades are good. Community service is always a must too, so make sure you're out in the community, and just it shows your commitment to the community as well when you do community service. And then once you getting in I think is one of the hardest things, one of the first hurdles to jump through. And then I did 4 years of med school. The first year of med school, first 2 years of med school, actually, you're literally like sitting in a desk for 8 hours a day just studying. And then you do even more studying after your class time is over. And then your third year of medical school is where you're actually getting to see patients. And you have rotations. And you do your rotations in medicine, pediatrics, psychiatry, surgery. And you do those rotations, usually about 2 months long. And that's when you actually get in and get to see people and get what you've been studying for the past 2 years, which is fun. And then you finish your fourth year where you take different things in your specialty, whatever you're looking at doing, either pediatrics or surgery. So after you finish med school, you're not done yet, you have to do residency. And residency is where you specialize in whichever area that you is your area of interest. And so mine was pediatrics. And so I did 3 years of residency at UT Memphis, which was great. It was a wonderful experience. I think Memphis is a wonderful place and a great place to train. And I did 3 years there, and then I was asked to stay for an extra year to be chief resident. So that's kind of all what goes into being a doctor. It's a long road. A lot of times kids will ask me, what grade I'm in, and I joke with them that I'm in like the 24th grade because it feels like I've been in school forever.
Forever, and that's the way it appears.
Right.
And I would imagine those that are supporting you believe that to be true too.
They're tired of graduations. They don't want to go to any more graduations. They're done.
Good. Okay, Dr. Hayes.
Like Carlinda, I had to go through several steps before I became a speech language pathologist. The first step was to get a bachelor's degree. And it's very important that while I was in school that I made good grades. That was really important because you have to get a master's degree to become a speech language pathologist. That is the degree that is required. It's not a doctorate. That was extra that I did. But knowing that I needed a master's degree and I needed to get in grad school, when I was in school, I said, okay, I have to focus, because I'm going to be applying to schools and they're going to be looking at my grades. So did that, and then in order to get into a master's program, they wanted the GRE. I also think they take the MAT. I took the GRE, and so then you have to do your master's. You have to apply and get into your master's program, and it's very competitive. There are few speech language pathology programs around the United States, so that's why it's really important to study hard for the GRE and to make good grades so that you are able to get in. And while you're there, they have you to do clinical hours in addition to your coursework. And you do your clinical hours in medical settings, in a school setting, in a variety of different settings, because as a speech language pathologist, we work with people of all ages in several different settings, which is one of the most rewarding things about being a speech pathologist, is that I'm not just limited to being in the schools. I also work in the nursing home part-time, and you can work in the hospital. So in school, they have to teach you how to work in all those different areas so that you can be specialized in all the things that are required. Another area is the area of swallowing, which a lot of people don't know that we work on, feeding and swallowing and things like that.
Feeding and swallowing, that's some area, what does that mean?
Well, sometimes when people have strokes, they often lose the ability to swallow or swallow safely. And so we would teach different strategies such as a chin tuck or maybe even thicken their food so that they can swallow without aspirating and the food getting in their lungs and so forth. And they would see a speech language pathologist for those services. And then after that, I went to after I finished my master's degree and got all my training, I was required to do a clinical fellowship year. And during that time, I work under a supervisor who trains me on the job and teaches me how to do my job. But I'm actually working as a speech pathologist, but I have someone teaching me and guiding me along the way for a year. And then after that, then I'm a speech pathologist. And so then you get CCC SLP, which is the Certificate of Clinical Competence in Speech Language Pathology.
Very good. And of course, I think we've got about 4 minutes left in this particular segment of the show. And Dr. Smith, why don't you think in terms of dealing with some of the young people that you have to deal with, and what you might be able to do in order to help them better do what you would like for them to do?
I think I have 15 minutes and sometimes 30 minutes to see patients, which is hard, but I try to also always make sure I'm a positive experience. I know a lot of people are afraid to go to the doctors because they associate doctors with shots and they're always afraid. But I try to make sure it's a positive experience for kids, and I want to use that 15 minutes that I have with them for encouragement, whether it's in school, whether it's in sports, and just kind of make sure my office and our nursing staff is the medical home. We're kind of not using the word office anymore. They actually like the term more so medical home. And I think of our place, our clinic like that. I think we are a medical home. Sometimes when kids are going through having a bad day, or even we had a patient whose mom was diagnosed with cancer, and they came to our office because we're their medical home, we're their family, and they came and told us about it, and we all kind of cried together and worked together. So I think we're just another example of the extended family that patients have.
And so you really enjoy what you do?
I do. It's challenging. It's hard, but I do enjoy what I do. I love kids. Kids are amazing. They say some of the funniest things, and they're so honest. And I definitely enjoy getting to see kids and watch children just grow up. It's amazing. It's a gift, and it's a privilege too.
Dr. Hayes, what about you? Do you think that you're enjoying what you do and the people enjoy working with you, and et cetera?
Yes, I love the field of speech language pathology. It is so absolutely rewarding to be able to to have a child come into your room and not be able to communicate, and then within a few months after you hear that word said, or after you have the opportunity to see that sound develop, it feels really good. It feels really good because I can actually see progress. And a lot of times in many fields, that's something that people are not able to see, but I can see progress. I can look at my numbers and say, okay, they weren't able to say the k, 2 months ago, but now they're able to say it. And so it's very rewarding. Another rewarding thing for me personally is that I, as an African American woman, I get to work with students who are primarily minority. I would say in the area of special ed, there is a high prevalence of minorities in special ed, or who are receiving special ed services. Not sure why that is, why there's so many minorities receiving special ed services, but I do get to work with them, and they get to see a face that looks like theirs, and I can encourage them. And so it's been very rewarding, and I get to work with the families and talk to the parents, and it's just a way to kind of feel like I'm giving back to my community by working with them.
Very good. Dr. Smith, you've got about a minute to sort of summarize us here, and what are some of your final thoughts in reference to what you do and what we've done here today?
I think whatever kids or anyone chooses to do, it's going to be a hard road, and I think you have to just stick with it and have perseverance. And I'm thankful for my family and my friends, who definitely are just a great support system for me. And just whatever you do, make sure you love it and have passion for it.
And work hard at it.
And work hard at it.
I think both of you would agree that hard work is important in whatever area you're in, and to do well, and to sometimes meet the challenges, and sometimes not be appreciated for what you're doing, but the ability to be able to continue doing it just the same. Is that right?
Right.
And let me thank the two of you for coming by and giving us that excellent information. And let me encourage our audience to tune in again next week for another informative edition of Comments. Thank you and good morning.